So labiaplasty is a procedure done to either the labia majora or labia minora, or in some cases both. What that means is that it can be the external labia or the internal labia. It can give you a more symmetrical appearance. It can also make you much more comfortable to go about your day-to-day life if it's something that has been affecting your comfort levels. Many people choose to have labiaplasty based upon either complications with pregnancy, can be a genetic factor, or just for cosmetic reasons. They want to change the appearance, essentially, feel that something matches them. Another common reason is for discomfort. If you're an athlete or it's getting in the way of exercise, things like that, then it can be a procedure that can help to ensure that you do have that comfort as well as the confidence to live your normal day-to-day life. Now, the procedure itself is generally done under local anaesthetic, so it's a procedure that you can have awake. Although that sounds daunting to some, it can be good in terms of a much quicker recovery. And although you are awake, you will not feel the area because it's numbed with local anaesthetic. So you might feel that initial local anaesthetic injection, but after that you shouldn't feel anything, and you'll work with your surgeon. If you do feel anything at all, you can vocalise that to them and they'll make sure that you are fully numb and fully comfortable as well, because comfort is their priority for you at the end of the day. So some of the frequently asked questions I get with labiaplasty is, when I'm going to the toilet afterwards, how do I sort of care for the area? Now, as a general rule, it's not something to worry about too much. Obviously, everyone has to go to the toilet. One of the things that I would say is I would recommend just dabbing the area to start with for the first couple of weeks, just while the area is healing. Now, some people may see online that you can pour water on the area whilst you're going to the toilet. That's absolutely fine. If that makes you feel more comfortable, then that's something that you can do as well. It's completely up to you and your preference and how it makes you feel, but it won't have any detrimental result to use a little bit of water at the same time to pour on the area. It's not a problem at all. Now, another frequently asked question is, when can I engage in sexual intercourse after having a labiaplasty? Now, the safest thing to do with this is to wait 6 weeks unless advised otherwise. Now, if you're advised by your surgeon to wait longer, then that's up to your surgeon's discretion. But 6 weeks, as a general rule, allows for all the sort of sutures to heal, allows for the tissues to heal, and allows for you to be comfortable as well, which is the most important thing. In terms of exercise, a big question I get asked is, when can I return back to my normal exercise routine? Now, 6 weeks for exercise. I know it sounds like a long time, but it is very important that you wait that 6 weeks. Main reason being that any kind of activity that increases blood pressure and blood flow will increase blood flow to an area of trauma. Now, with the labiaplasty just being where it is an area that's susceptible to swell anyway, because you're moving, you're sitting. It's an area where the tissue is always going to be mobilized and slightly irritated, so you risk of swelling anyway. With exercise, you're going to massively increase that swelling, increase your risk of bleeding, and increase your risk of complication in terms of popping a suture early and things like that. So the 6 weeks we do recommend for exercise. Now, things like light exercises, yoga, stretching, that's fine to sort of resume within that 4 to 6 week period. However, 6 weeks for anything more strenuous. One of the main things I'll say post-operatively is swelling. It's very, very normal to get swelling. Most patients, I would say 90% of patients, get swelling. You do get the odd one that somehow breaks through the mold and doesn't. However, it's very, very normal, and sometimes that can seem a little daunting at first. It can take 6 weeks to 3 months for the full swelling to go. However, you will start to notice noticeable changes day by day, and things will reduce quite I'd say, a fairly regular interval based upon your own personal healing. Now, with labiaplasty, one of the most important things is maintaining the area, keeping the area clean. Now, your surgeon will discuss with you the best way to do this and what they would recommend for this. And they'll give you a treatment plan and a care plan so you know exactly how to manage this area. In terms of pain management, you shouldn't be in acute pain after a labiaplasty. It should be manageable. You will be sent home with a prescription for pain relief. Now, the biggest thing that many patients say is it feels almost like a burning or a stinging pain, and especially when you urinate at first for the first couple of days. Now, this tends to go away quite quickly, and it's something that can be managed with the pain relief, and it's not something to be overly concerned about. Now, should you have any other pain, then you will have access to a medical professional at any time. You can contact us, and we'll make sure to see you as soon as possible.